Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune, and today I'm going to tell you everything you need to know about the 24-hour urine albumin test or the urine microalbumin test. These are all tests that go with the same name. If you're watching this video, I'm pretty certain about a couple of things. Number one, it's very likely that you already had a simple urine test recently done and something came back abnormal in that test, specifically the proteins. So your doctor now wants to know a detailed picture of how much protein is in your urine. The other possibility is that you're a known case of someone with a kidney disease, or you're a long-standing diabetic, you have diabetes for many years and your doctor thinks that it might be harming your kidneys. Or it could also be that you have a condition of your kidneys like the nephrotic syndrome, which causes you to lose a lot of proteins. Other than this, it may also be that you as a patient have noticed that your urine is very frothy or very foamy and you're concerned about what could be the cause of this. And so you may also notice things like swelling around the face or the eyes early in the morning, or maybe your ankles are very swollen for no apparent reason. All these could be signs that you're losing proteins in your urine, and so either you electively or your doctor have decided to go ahead with the urine protein test, which is done over a 24-hour period. Today, I'm going to tell you everything that you need to know about this test. What is the meaning of urine protein or albumin or microalbumin? Why are there so many different words? Why is this so confusing? What does it mean when we say 24-hour urine protein test? Does this mean that you have to do something over 24 hours at the hospital? What are the normal ranges of this test? How much should it be? When should you be concerned? How high does the value have to be for you to get worried? What options do you have if the test is abnormal? And most importantly, how exactly do you even do this test? Maybe your doctor wasn't clear about how you're supposed to collect the sample. I'm going to answer all these questions in a very easy and simple to understand way so that you won't have anything left in your mind at the end of the video. And if you're So here's a little bit of a primer about the urine protein, the urine albumin or the urine microalbumin. I'm going to break this down into some really simple and easy to understand stuff. Your blood consists of something called albumin. That is a protein, and it's the same protein that is found in egg white. Your blood needs a significant amount of this albumin just to maintain its viscosity and its thickness, and also to maintain your blood pressure and something called the plasma oncotic pressure. You don't need to get into that. What you need to realize is that without this protein, your body will begin to lose all its fluid, and so it is absolutely critical. What the kidneys do and why they are so important and why this test is actually checking your kidney function is because it's the job of the kidneys to keep the albumin in your blood and prevent it from leaking out into your urine. What the kidneys normally do is they filter your blood continuously throughout the day, throughout the night, whether you're sleeping, eating, drinking, doing whatever it is you're doing, your kidneys are constantly filtering your blood. They keep inside the blood all the good stuff, the proteins, the nutrients, the minerals, the salts, everything that you need to function. Your kidneys make sure that all that stays in the blood. What they filter out, what they push into the urine is the stuff that you don't need. Waste products, things that medicines are made of that are of no use to your body, all kinds of other harmful stuff. They make sure that all this is pushed into the urine. So if your kidneys have any kind of damage, if your kidneys are not filtering the blood like they should, you're going to find that even some of that good stuff that they were actually keeping inside your blood is now leaking into the urine. And the protein or the albumin or the microalbumin, all this is the same thing, is now being found in your urine, and we need to know how much of this protein you're actually losing. The reason this test is done over a 24-hour period is because it allows doctors a way to standardize and compare between you and what is the established normal. That's why a single sample is not of much use, because you may not pass as much protein in one single sample as you would if we checked you throughout the day. So when we know how much protein you're losing over a 24-hour period, we know and we can compare this with known normals. So what this test actually does is you need to collect every single drop of urine that you pass in a 24-hour period. That means in one day, you need to collect all that into a can. You will then provide that can to the laboratory and they will measure the total amount of protein in that sample of urine. Now this is all the urine that you've been passing in those 24 hours. You're not going to flush it down the toilet. You're going to collect it into a can that the laboratory will provide you with. I'll go into the details of how you can do this easily, but that's what it means in toto. We want to know how much protein is being lost in your urine in these 24 hours, and that will tell your doctor the extent of kidney damage. There are other ways that we use to check the kidney damage, and sometimes we don't even need to collect your urine for 24 hours, but this is one of the best ways to know literally how your body is functioning over an entire day. That's why this test is called the 24-hour urine protein test. Now, why are there these three different names, protein, albumin and microalbumin? This is all the same thing. So the basic thing that is tested is called the albumin. Albumin is a protein, and that's why sometimes we interchangeably use urine protein or urine albumin. Then why the third word? Why microalbumin? So microalbumin is just albumin itself. It just refers to extremely tiny quantities of albumin that are detected in the very early stages of kidney damage. So when your kidneys are being damaged in the very early part, when you don't notice any symptoms, when you don't even realize that there's anything wrong with you, it's at that time that your kidneys are actually already leaking out very tiny little amounts of this albumin into your urine. Because it's so little and it's so tiny, we sometimes need specialized methods to even detect it. But the thing that we detect is the same albumin, the same protein that we've been talking about. When it's present in very tiny quantities, it's called microalbumin. That's not a different protein, it's not something else, it's just tiny quantities of the same substance. And that is why it is called with these three different names. I know this is confusing. I wish medicine had standardized names so that patients and doctors alike wouldn't be so confused. But now you know it's just the same thing. And I'm going to tell you in this video how much is normal, how much is abnormal, what a abnormal value even means, and what you can do next. So stick around. If you have varying symptoms like foamy urine, swollen feet or puffy eyes, then you should definitely consider getting the urine 24-hour albumin protein or microalbumin test done. I'm going to tell you everything that you need to know in a quick way. So as I've already told you, your blood contains proteins. These proteins should stay in the blood. They shouldn't be filtered by the kidneys into the urine, and that's what we measure in this test. If we find these proteins in the urine, it means your kidney filter is damaged and things are leaking out into your urine that shouldn't be there. It's called microalbumin because the test is capable of detecting even the smallest amounts of albumin that could be present in your urine, and this is very useful because it allows us to tell years before you experience any symptoms that there is something wrong with your kidney filtration. The smallest amounts of albumin in the urine are abnormal and need treatment. Doctors commonly advise this test for patients who have long-standing diabetes because diabetes with its high sugar levels damages the kidneys and causes the filtration function to suffer. We also advise these tests in patients with high blood pressure because the blood pressure also damages your kidneys. The tiny little blood vessels in your kidneys get damaged, their lining is destroyed, and proteins begin to leak through that into the urine. So these are the two most common reasons to get this test done. Other reasons also include some syndromes like the nephrotic syndrome, which is a disorder in which you tend to lose a lot of protein in your urine. While the amounts of protein lost in nephrotic syndrome are very high, this test is sometimes also advised to screen for that. Also patients with long-standing kidney disorders, people with lupus, any kind of autoimmune disease which could affect your kidneys, your doctor will probably ask you to get this test done. The most common symptoms that you are going to experience if you need this test include things like foamy urine, swelling on your body, and the swelling is because the proteins are now lost from your blood into the urine. Your blood doesn't have the necessary osmotic pressure to hold water inside, and this water then begins to leak into your tissues and under your skin. This is the reason why you see swelling on your feet, swelling under your eyes, a puffy face. This is all because the fluid that should normally be held in your blood has leaked out from through your blood vessels directly under your tissues. This is a dangerous situation because this means that you're going to get dehydrated. It's something that needs attention. Other than this, you might also experience fatigue, the tendency or urge to urinate frequently. The symptoms can be pretty varied, but swelling and exhaustion, fatigue, feeling tired, these are some of the most common symptoms. Foamy urine also very common if you're losing proteins in the urine.
Collect all the urine you pass for 24 hours in the can provided by the lab. Start at 8 a.m. on day 1. Each time you visit the toilet, collect all the urine in the provided can. The can will contain some chemical in it. Do not throw that away at the beginning. It is a preservative.
So what are the normal ranges in adults? The normal ranges in an adult is that you shouldn't be losing more than 30 milligrams of protein per day in your urine. Anything more than 30 is abnormal. Most adults will have values even lower than 15. Between 30 to 300, this is what is called microalbumin urea. Microalbumin urea. That means microscopic or very small amounts of albumin are being lost in the urine. You probably don't have any symptoms at this stage, but you can be sure that your kidneys are damaged. But this damage is reversible. So between 30 to 300, it means that this is the early stage of kidney damage, but which is completely reversible. More than 300, it means that there is now what we call overt proteinuria. If you are losing more than 300 milligrams of protein a day in your urine, it's quite certain that if this would also have been detected on a routine urine test, you probably wouldn't have needed this 24-hour urine albumin test, but your doctor just ordered it to confirm that the proteins are really being lost, because more than 300 grams of protein, milligrams of protein a day is a significant amount of protein, and it indicates that your kidneys are definitely releasing the protein into the urine. They are damaged, the filtration system is not working, and you need to treat the underlying cause as well as sort out any immediate or acute symptoms of this condition. What do high levels mean? I've already explained most of these to you. It could mean damage to your kidneys because of diabetes, because of high blood pressure. And the other thing that you need to note is that things like diabetes and high blood pressure, they also affect your heart. And people who have kidney damage because of diabetes and high blood pressure are usually susceptible or have already had some amount of damage to their heart vessels, to the tiny blood supply that goes to the heart itself, and you are definitely at risk for heart disease. So if you have proteinuria, you should definitely consider getting all your systems checked. Proteinuria means there is a systemic problem, your kidneys are damaged. If it's accompanied with any systemic disease like diabetes and high blood pressure, you definitely have to get your entire body checkup properly done. I would advise other tests like the 3-month average sugar level, your cholesterol levels, an echocardiogram, which is an ECG, as well as a general physical examination by a qualified doctor to make sure that you're not at risk for something else as well, because kidney damage with high protein loss in the urine is usually not a good sign, except in people who have a known kidney disease. Losing a lot of protein in the urine is not a good sign under any circumstances, so please go ahead and get yourself evaluated.